on the anatomy, but we're going to continue to go on and on the anatomy parts as we move into physiology and all of these. So we stopped at some point at the accessory sex glands. Okay, so at that point, I think the testes, the epididymis, the vas deferens, the urethra, and now we're going to go basically as the vas deferens leave the testes or the scrotum and go inside the abdominal cavity, then at that point it starts to be called urethra. Then from that point on, it is abdominal urethra and then penile urethra as you go to the exterior. So this is really like a big conduit. Okay? The only difference is that while in the abdominal cavity, you have these accessory sex glands. And then we started to mention a little bit why there is. Why do we have those? Why do we have a prostate? Why do we have bulbourethral glands and so on? And the major reason, and I mentioned, is that because of survival of the sperm cell. Okay, that's by far the major reason. And you have to think at that point, obviously, when we talk about the testes and how it is formed, you're talking about, or testosterone is produced and so on, you're talking about an organ. Okay? But what is produced is an individual cell. Billions of them, but it's in an individual cell. At that point, that cell, in order to survive, as you have to think as when you do like experiments in cell culture. What do you need? You need buffers, you need sometimes antibiotics, you need the right salinity or molarity. Why? Because anything that happens, anything that changes in the environment, it makes the cell shrink, explode, pH is different. So what it has to happen with that accessory glands is that to provide this environment so this sperm cell can survive for a relatively short period of time after it goes to the exterior environment, but it's a very important period of time. Okay. On top of that, you're going to see later that once we start looking at really and probably midway through the class to the course, fertilization is a very biochemical reaction. In order for fertilization to occur, it's not simply sperm cell meets egg and it happens. You have to have the certain amount or the right amount of receptors, the right combination of receptors in the membrane of the sperm cell in order to make it occur. And this environment that is provided by these accessory glands do have that. Now, we're going to have lots of names, and one thing that I'm going to try to do is to go through some of these rather quickly, because it is a lot of little names. I'm not going to be doing a lot of little things. And my idea for the accessory sex glands is not that again, exactly what it does, each of the fluids and so on. It is that you have this concept, this larger concept of, for example, motility, fertility. Of course, they are important. They look like kind of is in some of the animals. So it is really, even when you're trying to dissect this inside of the animal, it is rather weird to dissect all that. It is really, they're tied with this tube, and really all of this in the base of this abdominal cavity. It is not exactly very easy to do it. And some of them are rather small as well. So you have all the way from prostate gland and so on. On the slides, you're going to have a slide like this. Oh, they are bilobed. They have two of them. They disseminate or non-distinct. They in rams, always embedded in the urethral muscle. Nice, very cool. It describes the anatomy. I would never, probably not. I would never ask that, probably, very important. I would never ask you this. Why? Because I think in the slides, as I told you, the slides, especially in some of these first classes, has a lot more information than you're probably going to need. But it's important that you have at least this sense of how they look, what is about. Normally the prostate, and this is the next slide, it doesn't necessarily, and this the other thing that you know in the slides you have is some comparative differences between species when it matters. But basically, for example, in the prostate, the most important thing is that have high concentration, for example, these ions, you know, sodium, chlorine, calcium, magnesium, and this will be important, for example, for the sperm motility. This is actually also the one that tends to flush or clean the urethral canal before ejaculation. You know, at some point after this canal, this urethra also will serve as the conduit for urine. So the two systems at that point, they bind together. So sometimes you have a little bit more of this fluids or these accessory gland fluids to wash the canal before ejaculation. All the other ones, we're going to have a few, like before, during these slides also you have a few cases, like before I think you had like castration, I put some slides here on prostate enlargement. I might ask you this as it becomes, or as you start having more information of the hormonal side of what controls what. So, like for example, in prostate, we know that, you know, you do have to, once you have this, for example, testosterone and LH, it promotes the enlargement of this one. So in humans, in animals, some animals, especially dogs, they might have problems with prostate enlargement. Humans, so far, you know, is quite a bit of an importance, you know, especially for older men. And in general, you can do or deal with that in two ways. You either remove the prostate or you do a hormonal treatment with it. Okay? Can you live without the prostate, or can you live without some of the other accessory sex glands? You can, of course. The only problem, and in general, this is the issue with some of those surgeries, either in animals or in humans, is the access to it. As I told you before, they are in a very weird, compact, surrounding a tube place. So in order for you to remove, sometimes you have to actually remove the tube and then reconnect. And within that tube, of course, there's lots of vascularization, lots of nerves, so you deal with other problems as well, especially men. This is very important. So, and then you go into all the other ones, bulbourethral glands, located along the far end of the pelvic, the variables inside. In this case here, especially for from the bulbourethral glands, it adds, for example, lots of volume. And then you might ask, is this important also? Because it's important not only to have electrolytes and buffers and ions and so on, but is it important for these accessory glands to provide volume to it? And it is. For once, you know, the ejaculate with the sperm cell needs a certain volume to exist and to actually swim. The other one is that in some species, once ejaculation occurs, they need to have a certain volume in order to stay. And normally the site of ejaculation is the end of the vaginal canal, and they need a certain volume in order to create pressure to enter the uterus. So sometimes, and in some species, in this case, the boar or the pig, you're going to see, we're not going to go into, again, in details about species, but what you have is that, you know, species like the pig have very long vaginal canals, very long uterine horns. You do need volume in order to diffuse all of that sperm cells into the reproductive tract of the female. Okay. Penis, and then you urethra. So you have another one, and this is mostly for lubrication. I mentioned about the urethra, which is just the continuation of the vas deferens. It enters. It has all this portion here. All this portion here that goes all the way here, and you have abdominal urethra and ischiourethra or penile-urethra. This is from a bull. And what you do have there is that basically is a canal is the very end of the transportation of, you know, sperm cells. There's nothing really super special about how is the mucosa or how is the muscle layers around. You put it in there that, he has a mucosa, he has a muscle, he has, connective tissue. So I'm not going to be asking that kind of thing, but at least they exist. And so on. So the rest of the slides, I think they are more on different types of penises or different types of all pictures of how they look like in different species. But that's basically it. By the time we finish this class, which has like quite a few slides, what is the most important part is testes, the epididymis, the vas deferens, how more or less they look like in terms of overall anatomy. The seminiferous tubule is the one, or the interstitial space. Those are the ones that is really important that you know the configuration and how the sperm cell is where the sperm cell is produced and how. Several tubules. I mentioned some of the stuff on the thermal control of the temperature, on the testes, all the boviniform plexus, canals, how the exchange of temperature is done from the arterial blood of the testes and the venous blood. So these are the bigger picture things. These are the things that are important, okay? That you know where they are, how they look, and that you have, again, more or less this idea of how many accessory sex glands there are, why they are there, what is the major function. Why am I going a little faster on this? Because really the other classes will be more important. Once we go to the physiology, endocrinology, this is and eventually we always return to the anatomy. Is that okay? Yeah? Very good. Any questions so far? No? Good, good. So let's go to the female system. So, as I mentioned before, the difference, and I mentioned the function, of course, because function and form will be tied. In the female, it is a very different story because you're not producing billions of cells as it is done with the male. So this idea that you have to have this super long tube with so much, things to transport and add fluids like the accessory sex glands and so on, this is not the case anymore. What you do have is that the two things are obviously the same: gametogenesis and steroidogenesis. So the production of an haploid cell, the sperm cell in one side, the oocyte in the other side, or of hormones. In one side, mostly testosterone, in the other side, mostly estradiol and progesterone. We're going to go through that. So these are the two major functions, and these are where some of the anatomy stuff will be surrounded. All of these things, you're going to see that the major thing for the, sorry, we didn't go there, but the major thing for the major organ will be the ovary. The only thing is that the ovary it's within, in most of the species, and actually all the species that we study in domestic animals are within the abdominal cavity, so they do not have the issue of thermal regulation. I will mention later, they have something similar, it's not exactly similar, but something similar in terms of exchanging or really vessels that are really tied together in the exchange stuff. But instead of exchanging temperature, they exchange hormones. Okay? It's an anatomically somewhat similar system, but very different functions, and I'll explain that later. Why is the oviduct in front of all this? Okay, so over is that. So oviduct and uterus, and then the vaginal canal. So the ovary will be producing the gametes and the steroids. The oviduct will be actually for gamete transport. This is the only part that really looks like or resembles what we see a lot in the male, which is a tube, a long tube. This is where fertilization occurs, or fertilization, and most of the species do not occur inside of the ovary, do not occur in the uterus. It does occur in the oviduct. Okay, it is important because the timing of fertilization will depend a lot on the oviduct. Okay? In some ways, you're going to see later and during the fertilization class, we're talking about, when I say timing, we're talking about hours, many of the species. And this is the very thing that is probably special about the reproductive system compared to others, is that in order for the gestation to occur, the timing and the synchrony of events have to be very tight, very, very tight, which also basically means that some places inside of the, especially the female side, also serves as storage of things. So you store, wait for something to happen, so something meet at the right time. So this is the whole thing. Uterus, of course, will be it does produce one of the hormones, which is very important, called prostaglandin. And the uterus is, of course, the site where the embryogenesis and placental growth will occur. Okay, so this is where the new offspring will go throughout their gestation. So you're going to see that it's also, it is not the only one, because the ovary is quite plastic. When I say plastic, modifies a lot, but the uterus is by far the one that can modify the most. Okay, it will go from, let's say, a rest state, or when I say state, a non-pregnant or non-gestational state, which is normally in most species, even in large animals, quite small, to something that can carry 45 kilogram calf, plus membranes, plus placenta, plus fluids. So the rate of enlargement and returning to the cyst is probably the most plastic organ you're going to see in your body. Okay. These portions here, don't prostaglandin, leukolysis, it is there. Keep in mind, we're going to return to this on and on and on. We know to explain exactly all this physiology behind, but just keeping in mind this bigger picture functions of them. The cervix and the vaginal canal. So you have the ovary, a little tube that ties the ovary with the uterus. This is theoretically where this tube where fertilization occurs. After that, after the uterus, you are starting to go into the external environment. The cervix is the door. Really is some people may consider even part of the uterus, but it's, tissue is very tissue specific. It doesn't look like in any way what the tissue of the uterus look like. And the major function of this tissue is protection. Okay, so it will have to protect, for the most part, the uterus from being invaded by microorganisms or trauma from the outside. And of course, during gestation, it has to be closed in order for the fetus to develop or not to be expelled by physical force. It can be like the oviduct can serve, parts of the uterus can serve, and the cervix can serve as also reservoir of sperm cells. So before, that happens because of the necessity of synchrony to occur fertilization. So sometimes you can have sperm cells being, and when I say reservoir, it's reservoir for a few hours. Okay, it's not reservoir for, take a vacation there. But it's just a few hours where it can wait for that specific time, which is very important for fertilization. The vagina or the vaginal canal is obviously the organ for copulation. It's normally the site for semen deposition during natural mating, and in general has also very specific kind of mucosa. Is a kind of environment that also tries to avoid contamination. It is the place where it shares with the urinary tract, somewhat similar to the, is where the urethra arrives as well. So that's the major function of the vaginal canal. Very good. So let's go. So the same way that on the testes, you have those tube-likes and microtubules with a kind of a circular shape, where you have the cells on the outside, germinal cells, which means the cells that will give rise to sperm cells, changing and modifying all the way to the lumen, and from the lumen being expelled and going to the rest of the rat testes and epididymis and so on. Now think about the ovary. There's no similarity. Nothing. There's zero. Think about this zero. When I say zero, it's like zero. Couldn't be any different. Why? I didn't invent this, but this stuff is, for whatever reason in evolutionary biology, the female went from, the difference in male and female went from one producing billions of cells every day, and the other one producing one egg, or maybe few, every so many days. The difference in terms of frequency of what is produced is enormous, okay? There is some reason for that. One of that is because who bears the gestation is the female. So it is a lot more careful. Know what is produced and when it is produced, okay, that egg, and when it liberates that egg. The other one is that there is a limited amount of cells. As I said before, one that is producing, and even an older male will keep producing sperm cells. In the case of the female, you have a set population. By the time women, for example, reach menopause, that means that the reservoir of these cells is over. Okay? That's what it means, you know, from an ovarian standpoint. You have no longer more, in this case, ovarian follicles that produces estradiol that can, once ovulates, produce progesterone to continue. So basically at that point, estradiol and progesterone is no longer produced in vast amounts, and you no longer have a cycle. That's what the menopause is. What is this picture? This picture, it means that, you know, theoretically you start here and you go like this, okay? Most of the ovaries are like this. You have the medulla of the ovary, which is kind of the support system, circulatory nerves, and the cortex of the ovary, which is where the function or the functionality of the ovary really is. What happens in the ovary, it's not like this is for educational purpose. It doesn't go like clockwise or anti-clockwise. You know, the follicle doesn't move around, you know, your ovary. What it happens is that one follicle here, and imagine this continuation happens only in one place. You have these primary follicles that once you start to develop, they grow, they grow, they grow. And in general, what happens is that it grows in waves. And when I say waves, it can be a few waves, but the waves are synchronous with what? With the cycle. So in the case of women and a few primates, you have a menstrual cycle. In most of the other domestic animals, we call an estrous cycle, okay? In case of this estrous cycle, since we're going to be talking more about the domestic animals, it's really this process from growing the follicle all the way to ovulation. Once that block occurs, you call this a cycle, okay? So from producing 1 billion cells, you go into this cycle where at the end, and you see this picture here, it is your egg is inside of this follicle. And eventually, this thing explodes. It explodes. There's no other way to put it. It just explodes. And from that egg is captured, or from that follicle that explodes, the egg is captured by the oviduct to be fertilized. The remaining of that tissue forms another structure. very similar to the male, right? Completely. Like it's like it couldn't be any different, but that's how abrupt. And this is one thing that is true. It's much more, the female cycle goes into much more changes, hormonal changes, and abrupt changes than what happens to the male side. Okay? So medulla, the cortex, oocyte. So some of these names, oocyte is egg, female egg, or oocyte. Sometimes I use interchangeably. It's the gamete for the female. I use both names. Follicle. And this is a name that is general. You can have a hair follicle. You can have a bunch of other things. An ovarian follicle. But every now and then I only use follicle, so just understand this is the ovarian follicle. The ovarian follicle is this one that I said grows from basically the egg surrounded by just a few follicular cells into a really large, it's not a mass, but it's a really large structure normally filled with fluid that eventually explodes or ovulates. Some of these other names, the superficial epithelium and the tunica albuginea, this is the structural tissue around the ovary. It's not functional in terms of the function of the ovary, major function, gametogenesis, steroidogenesis, but obviously it holds the ovary together. Okay, it's a connective tissue that holds the ovary together. Obviously, the ovary inside the abdominal cavity, and this happens to most of the organs inside of you, they have to be bound or tied with the abdominal cavity or even other organs in order to have the position, the place. Okay, so once we have some of the labs, you're going to see that some of the species are always tied with big ligaments, strong ligaments. It's basically because you cannot have the ovary just bouncing around and be around. So they have to be placed, they kept in a certain place by these ligaments. Okay, so we went through this. Primary follicles, secondary follicles, growing or entering follicle, and mature follicle we call Raphian follicle. If you go back to the previous, this would be a primary follicle, secondary follicle, entering follicle, and this one a Raphian follicle, or sometimes we can call pre-ovulatory follicle. It is just a growth. As it grows, we keep changing names. Does it matter? Does it change function? It does. Okay, it may produce more estradiol. It may be, at some point, you can have the cells around the egg with different functions. We're going to go through all of this, but it matters. The other thing is primary follicles, in general, are not exactly, and a lot of the primary follicles are not controlled by hormonal levels. Let's say you have, now in the next slide, we mentioned there is a certain set number of follicles, of ovarian follicles, and this is when, once you're born, you have that number. It changes. Maybe if you have different reviews in the literature, you may have different numbers, but it's in that 50 to 100,000 in different species. Remember, the other one is a few billions a day. The female, you're set with 50 to 100,000. Then, for every cycle, a few of them will be what we call recruited to start the cycle. And in the case of, let's say, cows, horses, equine, bovine, you're going to be ovulating one every cycle. Humans, for the most part, one. Some of these species, every now and then, you're going to have twins. Some other species, what we call polycotus, they always have many. Cats, pigs, and so on. Okay? The process is very similar. It only happens that they are made to ovulate several of the follicles and not only one. Okay? And these layers of follicular cells, and this is a big difference. Like in this case here, you see that, the egg, and in general, the pictures that I show this big ball with a smaller ball. inside. Smaller ball being the oocyte, the actual oocyte surrounded by some cells of the follicle, but the follicle is this bigger one. In most species, the smaller ball is really, really tiny compared to the big ball. The only thing is that we leave it like that for illustrative purposes. It's just to make it easier for you to understand. Okay, so just to give you this size kind of idea on. What is the difference? What are these follicular cells doing there? Like you only have a couple on the primary follicle and then it grows, it grows, it grows. These will be the oocyte does not produce. The oocyte is just the egg, okay? It doesn't produce hormones. It's there to be fertilized and then produce milk. Who will produce actual estradiol, for example, will be eventually these follicular cells. They're inside. So the whole wall of this follicle, which you have, you're going to see the actual names as it grows. You'll do all of that steroidogenesis from receiving, androstenedione to going into testosterone, estradiol, or progesterone. The biochemical pathway is very, the difference, molecularly speaking, the difference between all of those are really small. The difference between progesterone and estradiol biochemically is very small, or even testosterone is very small. So what it means for one cell to produce progesterone or estradiol is basically if the cell has one or another enzyme. That's the only difference. The same way for the male. Why it doesn't produce estradiol? Because the Leydig cells has the machinery to produce just testosterone. It has all the enzymes to produce testosterone. And that's why sometimes when you have some problems in ovaries or in the testes and you can produce a little more of one than the other, you end up having lots of secondary characteristics problems. So if a woman produces too much testosterone, you will start having male secondary characteristics, such as hair, muscle, and so on. The opposite is the same. If a man starts to produce too much estradiol, they start acquiring more of the secondary characteristics of a woman, okay? Corpus luteum, like some of these names, so primary follicle, secondary follicle, antrum, or pre-ovulatory follicle, that's fine. You have the oocyte, and you have some of the follicular cells, nice. Antrum, it is this ball. You're going to see really well in the labs, like it's what you have in your, when you might have known or might have seen in the internet when you have like polycystic ovaries. Polycystic ovaries basically means you have lots of like little balls inside of the ovary. It's because these follicles, they end up growing and being filled with fluid. This fluid is really full of estradiol, in most cases, because it is producing estradiol and keeping it in there. So I think the reason that in order for ovulation to occur, you have to explode that structure. It fills with fluid, and also the other reason is that you keep estradiol. Not all estradiol that is produced by the follicle just goes straight to the bloodstream. It is kept in there. It is important for the development of the oocyte, and it is released into the bloodstream slowly. Okay, the bloodstream captures that slowly. Cumulus oophorus, zona pellucida. This is names that pertain to the oocyte. We're going to get to there. Okay, we're going to go to the exact anatomy of the oocyte pretty soon. Theca interna, theca externa, and then you have also granulosa cells. These are all the names of different layers of the follicular cells once the follicle is at this stage, big stage, Graafian stage, or pre-ovulatory stage. Why do we give these names or different names? Because yes, anatomically they are different, and they have different biochemical properties or biochemical functions. These are the ones that, as you go from the most external to the most internal, they process whatever is steroid in a different way until it is producing estradiol, basically. Okay. Corpus luteum. Corpus luteum is basically the name of this structure that we have after this thing explodes, ovulates. Technically speaking, this is the correct thing instead of an explosion. Once this ovulation occurs, the remaining of this structure, imagine, and when I say explosion because it is an actual traumatic sort of event. You have bleeding, you have blood coming in and trying to fill that space. But those cells, those follicular cells, thick externa, they rearrange during this time. And once they rearrange, because of the hormonal, changes that occurred right before ovulation, they transform themselves into luteal cells, what we call luteal cells. And that's why we say corpus luteum, okay? Which is in Latin is yellow body, because you will see in the lab that, once you cut that, and then it becomes like not a structure filled with fluid. It becomes an actual gland with this like a more like a solid gland, and it has like yellow body, and that's why you call it corpus luteum. And this is the structure that will then produce progesterone. Okay. Listen, under the microscope, this is really how it looks like, a primary follicle. This is the egg, this, and this. These are follicular cells. And this will grow into, of course, is increased by, in this case, it is 400 times at least. It will grow into a massive structure. Which basically means the oocyte will basically continue to be this size, but the rest will grow into much larger than this wall. Okay, so comparatively speaking, again, the small ball that we talk about is much smaller than the larger one, which is the follicle. Okay, again, thick externa, thick interna. If you see in the graph in follicles, the follicle, thick externa, thick interna. Basically speaking, the thick externa is more like what the tunica albuginea is for the ovary as a whole. Like you have this basic collagen fibrous structure that holds this follicle together. Do you need a little muscle around some myoid cells? You do. And the reason why you do is that inside of the whole ovary and actually inside of right around the follicle, in order for ovulation to occur, you actually need to squeeze the whole thing. Okay, so you squeeze until it pops, and that's the whole reason why you have some muscles there. The theca interna, it has like lots of capillary, lots of blood vascularization, and that's where you have some receptors, and that's where some of the precursors for estradiol arrives. Very good. Then you have this basement membrane. So the basement membrane. So you're going to have the theca externa. Normally you have then the basement membrane, which separates the interna from granulosa. In some species, you even have separating the two thecas. But theca externa, theca interna, the basement membrane, and then right after that, you're going to have, and the basement membrane is really pretty much like any other basement membrane. It's acellular. It's mostly made of sometimes either collagen or fibrin, and what it has is that it separates these two layers. The granulosa cells is then the most internal layer, okay, of this follicle. And when I say the most internal is like all the way here, and let's say you have this ginormous oocyte, it also surrounds the oocyte. Okay. Is it important to know that there is it surrounds like the whole internal wall here plus the oocyte? Yes, it is, because these cells here that surrounds the oocyte, which is more or less like it's very similar to the other granulosa cells, they will have slightly different function. And actually, once you ovulate, once this whole thing explodes, what it happens is that this whole thing goes to the ovule. Not only the oocyte, this whole batch of cells that surrounds the oocyte also goes. Are they important for fertilization later on? They will be. Okay? They have a reason to exist there. And then you're going to see later on that there's even another layer inside of these cells here, inside of this group of cells here, where you have connections and actual communications with the oocyte. Okay? They have very tight connections with it. This cumulus oophorus, this is what you call, like, this is all granulosa cells. Cumulus oophorus is this special granulosa cell that surrounds the oocyte. And what you call their corona radiata is this specific one-layer cell that really have the communication to the actual oocyte, even inside the oocyte. I know, it's like 500 names at this point. It's more complicated, but we're gonna be repeating these things the whole course. Okay, so we'll get there. Just hang it in there. Steroidogenesis, we're gonna go through this in much more detail, but the idea is that, from interna, thick interna, to granulosa cells, or thick interna, testosterone, basement membrane, granulosa cells, estrogen. The idea here is just to show that in the steroidogenesis process, they are very similar. It just depends on a few cells that have the right enzymatic machinery to transform one precursor to the next product. And we're going to be, again, going over and over, for you to have a good sense of how that happens. Ovulation. As I said before, it is a rupture. It really is a rupture of this pre-ovulatory follicle or this antrum follicle. Once it expels or once it ruptures, all the granulosa cells, which is the cumulus oophorus, go outside or explodes and is expelled from the ovary along with the oocyte. And the thing is, what do you mean by expel? Where do they go? Like, is the ovary physically attached to the oviduct? No, it is not. So it has a space. It has a certain space, but it's very likely, and most of the time, it is captured by the oviduct. Okay? But when you say there is a rupture, there is a little bit, for example, of hemorrhage in the wall of the ovary, there is. Okay? Can you have a little bit of pain? You probably can. Okay? But it depends a lot. But it is an actual explosion there. This is stimulated by this hormone here that is called luteinizing hormone, or as we're going to start calling more and more often, LH. We're going to see later on there is another one that we call follicle stimulating hormone, or FSH. We'll get there. But the idea is that you start to be familiar with these names. Okay, with the names of estradiol, progesterone, testosterone, prostaglandin, LH, FSH, GnRH at some point. We'll be okay. So the corpus luteum, I mentioned before, the yellow body. Once that ovulation occurs, you have this rearrangement of cells, and it forms this actual solid structure. You know, after a few days, it doesn't go from a fluid-filled structure to that automatically. It takes a few days for that to happen, but eventually, once the corpus luteum is matured, that's what happens. Ronaldo, does that occur every day or every time as we have menstrual or estrous cycles? It does. If the female do not get pregnant, this will continue to occur every 28 days in most domestic species, every 28 days in humans, and it is going. Growth follicle, explodes, ovulates, the rest, that is captured by the oviduct, the remaining forms the corpus luteum, and you're going to see later that this corpus luteum, if you are, or the female doesn't get pregnant, there's no fertilization occurring, what happens is this corpus luteum at some point will regress. Okay? There is a mechanism there which is tied with prostaglandin. And I said before, it was produced by the uterus, and it regresses. Once it regresses, new follicular wave occurs, and the cycle continues, restarts. So it's this on and on with every time, for example, your follicle ovulates, you go from estradiol that is high to none. Progesterone is produced by this corpus luteum afterwards. Once it regresses, progesterone goes from high to none, and it goes on and on. We're gonna learn all of these controls and everything, but it is, as I said before, much more abrupt. The female estrous cycle, it is an actual cycle. You don't have such a thing on the male side, and it is very abrupt, very traumatic how things occur. These are different names that we give. As I said before, the corpus luteum is not formed in one day from ovulation to actually forming an actual corpus luteum, mature corpus luteum. You call corpus hemorrhagicum in the beginning, basically because I told you before, eventually it is actually filled with blood. In order for this rearrangement to occur, it is filled with blood, so the color is red. That's why you call it hemorrhagicum. And corpus albicans is basically this final stages when the corpus luteum regresses. And once it regresses, it actually goes through a process of very, very fast apoptosis. So the mass or cell death, programmed cell death, and eventually what happens is that big yellow body decreases in size until it is actually non-functional, not producing any more steroids, but also leaves a little bit of a scar, in the ovary. And because of that scar, the color is mostly white, and that's why you call corpus albicans. Albicans, as in Latin, it means white. So that's the story there. So shape of these ovaries is not. This really comes from more of the German school of veterinary medicine, where they name. The American school, they tend to name more. The British school, they tend to name things more in terms of size. Some of the European schools, they tend to teach more in terms of size of known objects, or known, in this case, known fruit. So in this case, it's almond shape, berry shape, or kidney sort of shape, or oval shape. It is just, there's quite a bit of variation in terms of overall size of the ovary. The other thing that happens is that some species, such as, for example, a cow or women, you're not seasonal. So you can basically ovulate throughout the year. some other species, such as hare or the beach, what happens is that you will have, or you will only ovulate or have estrous cycles, the ewe as well, or some breeds of ewes, you only ovulate or have estrous cycles in certain periods of the year. Okay, it depends, especially the sheep and the equine. The major controller is light. Light will be one of the major controllers because melatonin tends to have a bigger effect, or a very large effect into how some of the primordial, hormones in the brain is actually produced. Okay. I know there is like 550 names so far, but is it understandable so far? Is it all good? This side, I know I'm prioritizing this side. I don't know why, but is that okay? All good? Okay, so the oviduct, which is uterine tube, fallopian tube. Salpinx is also the name that they give to the ligament, but fallopian tube or oviduct or fallopian or uterine tube are all different names that people give to this. We will normally call oviduct, but if you see in books or in readings some of these other names, it means the same. This would be a pretty good picture of what it is. So in this case, the uterus is in this side, the ovary is here, and basically the oviduct connects both. The only difference is that with the uterus, it's an actual continuation. It's an actual connection, physical connection between the two. With the ovary, there's no physical connection. So even if it is like millimetric space, they are not tied together. But in general, this first portion, which we call the fimbria, or the infundibulum, which contains a lot of fimbria kind of projections inside. And the reason why they have this fimbria is that they tend to move in a way that creates negative pressure inside the oviduct. Meaning, when ovulation occurs, it's almost like sucked into the oviduct. Okay, so once ovulation occurs, the oocyte almost is sucked to the inside because this fimbria, which is like kind of hair-like projections of these cells, tends to create this movement of fluid to the inside of the oviduct. They have different names in this case here. This one here is probably easier to understand because it really is more like a capture-like structure that surrounds a little bit the ovary. Then you have the ampulla and the isthmus. The isthmus is this place here that goes more in the beginning, closer to the uterus. And this ampulla here is the one that goes from the infundibulum, from the ovary towards the uterus in this, what we call more anterior portion. Ampullary isthmic junction. Why do we always mention this? Which sometimes is not sometimes, most of the time, is very, very hard to see from a macroscopic structure. But this is around here is where fertilization occurs. Meaning, once ovulation occurs, all this pressure, negative pressure, brings the oviduct all the way here up until more or less here. By that time, you normally have sperm cells already, being in sort of a quiescent state. We'll explain later. In this place, and once ovulation occurs, then they can meet somewhere in here. Okay. They have the right combination of fluids, is the right combination or the right environment for fertilization to occur. It is actually important that the oviduct is narrow by nature, very, very tight and it has to be to facilitate the encounter of the sperm cell with the oocyte. They have some of these, again, all of this structure is kind of, once we see in labs, the structure is also held by ligaments. So it's not like the oviduct is loose in the abdominal cavity, but has lots of like fibers and ligaments around that holds that structure together. And some of this is just basically, in this case here, is more detailed, macroscopic differences among different species. So it's more curiosity than anything else, but it's good to know. When I say good to know, you're not going to be in the quiz or final. Just nice to know. The microscopic anatomy is, I think, the only thing that is probably worth mentioning on the microscopic anatomy of these. So in the ovary, more or less, cortex, medulla, that sort of thing. The uterus, we're going to get there. But the oviduct, is almost like is a very tiny conduit. And one of the things that is important is that you have some of these, this is in the ampulla, but you have some of these projections, these folds, okay? Some of these folds will be important, especially on the isthmus, the one closer to the uterus, because that's where some of the sperm cells, they actually go and they stay as a reservoir, like this serves as a reservoir for a few hours. So they stay there in a more quiet state. One thing that you learn much further in this course is that they have to be in this quiet state for a few hours in order for a process that we call capacitation to occur. You don't need to know this now, but it is that change in the biochemical structure really the biochemical structure of the surface of the head of the sperm cell. And you have to have that in order to the sperm cell to be fertilizable. The other thing is, once ovulation occurs, you have a really big dump of this luteinizing hormone, this pre-ovulatory hormone that has to really spike. And one thing that it does is that once that occurs, the sperm cells, they become hyperactive. So they go from a quiet state to a hyperactive. But they only go hyperactive once ovulation occurs. Synchrony. They are active and swimming like crazy at the right time. Okay, so that's the whole story about why, and that's where I told you all this story so you understand why you would need to have some places for these sperm cells to actually get quiet. When I say some of the supportive structures, sometimes what we show to you, this is from a cow, the uterus and the ovary and the actual oviduct of a cow. And this is more or less how it looks like. You're going to get a much better idea in lab. But all of this, all these membranes, and if I could stretch this thing this way, you would see that all of these have these membranes attaching this piece of the uterus to this piece of the uterus, and you see that the ovary is here, somewhat tied here, that is somewhat tied here with the oviduct, and then those are all ligaments. That's what I was saying about ligaments. So when you actually open the abdominal cavity of a cow, for example, you can basically catch the whole reproductive tract in one bigger piece. It's not like you can separate those structures at will. And this is just supportive ligament, supportive structures. So anything that has mesovarian, mesosalpinx, mesometrium, everything that has the prefix meso, it's a ligament. Okay? Salpinx is this name that we also give to the, I mentioned before, to the oviduct. So mesosalpinx is the ligament that holds the oviduct together. Meso-ovarian is what keeps the ovary, this ligament that's surrounding the ovary, and mesometrium is actually what has lots of these, or holds the uterus together. The other thing that they are important for, this is normally from where nerves and vasculature arrives. Okay, they have to have a physical structure to arrive at those organs, so they arrive from these ones. From these things, yes, nerves, arteries, we call hypogastric artery, that, the one that actually supplies blood to the reproductive tract. But by then here, the most important thing for you to understand or to remember is this plexiform structure. In the male, we call it pampiniform plexus. And this one here is plexiform. So even I, every now and then, I said, name again? That's fine. The only thing is that I want to remember that is very important. One very important for thermal control. This one is going to be important for hormonal exchange. Okay? Okay, let's have 10 minutes more. Is that what it is? Of class? Really did not shut up. Sorry. So I normally give 5-minute break or so. Anyway. So the plexiform structure, then, as I said, from all those accessory or supportive tissues, this is the most important one. Now, you remember that for the pampiniform plexus was the testicular artery intertwined with the testicular vein. So it's basically the same vessel that just went in, circulated, went out. And you have, because of that, you have these differences, these big differences in temperature, and it helps the control of that temperature for the testis, which has to be at a much lower temperature in order for steroidogenesis and gametogenesis to occur. In this case, the change will be between, like, this is the vessel that is draining the uterus, the uterine vein in blue, and actually, this one here is going to be the ovarian artery, this one in red. So somehow during the development or during the evolution of the female reproductive tract, these two vessels, they, in a very specific point, they became they grew very tight together. Okay? And in this case, what happens here is that something that is produced by the uterus, and in this case is this hormone that I call prostaglandin, more specifically prostaglandin F2 alpha. You see just prostaglandin, it's fine. Why do they have F2 alpha? Because prostaglandin is a super important hormone for what? Shouldn't know, right? Okay, sorry. So for inflammation, okay? So lots of Advils and Tylenols that you take, eventually they have some anti-inflammatory effect, and some of that is because they also block prostaglandin production. So prostaglandin is not something that is specific to the reproductive tract. It's actually also something that is vastly produced by almost every cell in your body, okay? But in this case, for reproduction, the only way in which prostaglandin will be important is that it is produced at a specific time with a certain amplitude and pulsatility. amplitude and pulsatility in endocrinology is one of the most important things. Almost everything will be produced eventually. And normally, for several of the hormones that are important actually for reproduction, overall concentration doesn't mean much. What it means is like how much it is produced in this kind of pattern. This thing means something, this thing means another thing. That's how it works, you know, for lots of the hormones and how it, you know, tissue responds. Anyway, prostaglandin is produced not for inflammatory reasons, it's for other reasons. And one thing that would happen is once it goes to the uterine vein, the regular or the right pathway would be leaving the vein, going straight to the heart, lungs, down, and back. Okay? It would be enters the general circulation. The problem with this hormone is that it is metabolized very quickly in the lungs. So the thing is, in order for this prostaglandin to have the effect that you want, you would have to go first to the ovary and then back to the general circulation where it can be metabolized. So nature found a way to do what? Before that prostaglandin would go to the general circulation, you would give a little stop at the ovary and then goes to the general circulation. And that goes how? How do you think that would happen? How do you think this exchange from the uterine vein to the ovarian artery would happen? First of all, they would have to be physically very connected. Okay? What would be the second condition there?
Concentration gradient.
Gradient difference. So you would have basically none going to the ovarian artery. So eventually you have a portion of that prostaglandin going to the ovarian artery, and from the ovarian artery reaching obviously the ovary. And in that case, prostaglandin would act on the corpus luteum. Again, we're going to go into all this mechanism at some point, but you need to understand how that happens. So again, same thing, is an exchange, but a very different principle in terms of the function compared to the male side. Okay? Very good? Make sense? I think this part here we're going to see this portion later on also on once we start doing looking at placentation and early embryonic development, but perhaps this is even more important. Horn, the body, and the cervix. The cervix, as I said, is very fibrous structure, which is the door to the actual uterus. Then you have the actual uterus, where you have normally in humans, the uterus, it's one small cavity. In most of the domestic animals, they are what we call cornuated uterus, which basically means they look more like this. You have two actually chambers. They are connected by one single piece that we call the body, but then you have two different ones, which basically means in lots of these species, gestation will occur in primarily one of the horns, and then we call horns each of them. And this is just an anatomical difference between most domestic animals and humans. You're going to see later endometrium here. We're going to go later, but it's just the internal layer of the uterus. You're going to have the endometrium, the myometrium, the mesometrium, or the epimetrium. There's different names there. Basically here, these are different types. Most species will be like this. One cervix, a body, and two horns. Okay, so that happens cow, ewe, doe, mare, human. The human in this case mostly one body, and and the pig as well. Don't worry too much about bipartite, modified bipartite, simplex, or bicornuate. In some species that we normally deal a little less, we talk a little less, especially in this class, they actually have 2 cervices and then 2 horns. Okay, and actually the opossum has actually 2 vaginal canals as well. So these are, this point, just so you have a greater view of how different they can be. At the end of the day, they are very similar, and not very. Doesn't really matter much to us. How many of those we'll have. The microscope, and then we go. So we went to the ovary, oviduct. We talk about a few things that in vasculature and support the tissues, and then the endometrium, the uterus, different types of uterus, microscopic structure. But in this case, really is the microscopic structure of the uterus is the most important part. Why is that? Because you're going to see later that, first of all, obviously you have the lumen, you have the endometrium, which is this internal. It's not only the mucosa here, it's just this internal layer here, which also contains lots of glands. Then you have the myometrium, which is the muscle layer. And aside probably from some of those tunica darkus muscle or albuginous muscles that has in the testis for control of temperature, the muscle of the myometrium is by far among all the muscles in male or female reproductive tract is the most important in function. And why is that? Because in order for parturition to occur, that layer has to be very strong, and they have to contract at a specific time. So they have a super big and super important function, not only transport of the semen through the sperm cells through the male tract. No, this has, and it's actually a very, very large muscle. Okay? And you have what we call the perimetrium, which is what holds the uterus together. It's the membrane, the ligament that surrounds the whole uterus, okay? The connective tissue that surrounds the whole uterus. So the inside of this space here, then you do have what we call these uterine glands. We're going to see later on in like these types of, and then we're starting to go also into the physiology of it. The uterus will have, and different species have slightly differences in terms of how the surface of that endometrium looks like. But overall speaking, what you do have is that, let's imagine that you have fertilization occurred and you have a new embryo developing. Now what you have to imagine is that embryo, what we normally think is that is at the end of gestation. Once the placenta is in, you have the umbilical cord, you have the whole shebang, around the baby. Imagine that the uterus have to have a certain system in which, at the very beginning, the embryo will have to survive without any attachment. Just when the placenta is formed, is that you're going to have a physical attachment, basically meaning nutrients, gases, exchange, and all the other things occurring between the baby, the fetus, and the mother. Which means for a certain period of time, and when I say a certain period of time, I'm talking about a month or more. This conceptus or this early embryo will have to survive on what is in the lumen of that endometrium, of that uterus. And this is why the glands are important. Why? The glands will be producing whatever substrate that is necessary for that early embryonic development to occur. Okay? You're going to see also later that, we're going to go back to the endometrium being the point of contact between the mother and the new formed fetus, and in this case, the placenta formation. You're going to have lots of what? Cell communication. Lots of cell communication occurring at that point. And that's why you have, when in this case here, say between caruncles is basically, once you have, for example, one of the uterus, especially from species that have, the caruncles a little bigger, and you open up, it looks like, a smooth surface with lots of little pimples, which means even on a macroscopic scale, you would say they do different things. They have to do different things. And one of those things is that some of these portions are used for the attachment. Some of the other portions are used to produce this glandular substrate. Okay? So in this case, what happens is that all the development of this internal layer of the uterus will be somewhat important to produce this glandular substrate, will be important for the attachment. And you're going to see, we're going to talk about these names, caruncles, the lumen, the endometrium, and what it takes for them. Not so much important here, so the pseudostratified columnar type or stuff is not exactly important. We're going to see later on that, lots of this development of this internal layer, it is driven by progesterone, estradiol, and some other hormones. Menstruation in this case here, just as a more of a curiosity thing, but the endometrium, they have to go into a certain hyperplasia and also hypertrophy of cells. The only difference is that only humans and some primates, they develop a very thick layer up to a certain point, and if gestation does not occur, all that endometrium is basically removed. Okay, so, and with that, because it is somewhat vascularized, you have bleeding. In all the other species or domestic animals, you do not have that. You do have modification of the endometrium, but not to the point of hypertrophy to having so many cells around the vascularization that would be removed. Good? Nice. So see you guys on Thursday.